We wish him full recovery. Dr. Patel will now read a message sent to us by Senator Kennedy. Dr. Patel.
Thank you. And I know that Senator Kennedy appreciates so much of the work you're doing, and I just want to thank you for inviting him and then allowing me to come and, even as woefully as I can, try to impart what he has written pen to paper that he wanted to make sure that this audience heard. So first of all, I just have to thank both Dr. Gawande and this entire panel and the organizers for this event, the World Health Organization and PAHO for hosting this here, because we do feel like this is a great day, and we're excited that this is not just one day that's a drop in a cross-section of what's going on, but that this will continue, and that we look forward to an international dialogue about how we can improve not just the surgical care in our country, but health care overall. And I wanted to just share a little tidbit about something that is a testimony to how important this is to Senator Kennedy. As most of you probably know, he's been dealing with a personal battle with cancer and has recently had surgery himself at the Duke University Medical Center. And one of his comments to one of many of the surgeons that he had during his procedure was, you know, there's this checklist thing that they've got at the Harvard. You guys need to talk to them. They're doing this. Atul Gawande, he's doing these great things. You need to make sure you guys do this checklist. So even as he was going through a sleep-awake procedure, he still was going through in his mind what needs to get done to make sure that our health care is not just the best in our country, but across the world. So having said that, before I read what Senator Kennedy has written, I wanted to offer kind of a challenge back to you. So often we come together in this town in Washington, D.C. and talk about these great initiatives and these great ideas, and we depend on you who do the work that you do to really come back to us and then challenge us, and not just after today, but constantly in the future, reminding us, you know, that thing that we talked about, the Safe Surgery Saves Lives initiative, what are you guys doing to follow that up in Congress? How are you going to let this shape healthcare reform? As those of you that are from the United States realize we have a lot of challenges that we must face, not just this year, but in the coming years. But we also have an opportunity to learn from you. So I offer you, on behalf of Senator Kennedy and on behalf of all the legislators that care about this, which I would say are almost all of them, that we need your help, not just today, but ongoing. And that's from all the countries involved. So now let me get to the important part. All right, so dear colleagues, I wish very much that I could be with you all in person for this special summit on international health policy. I don't have to tell you how grateful I am at this very moment for the extraordinary revolution that is taking place in the life sciences, for the new discoveries and amazing treatments it is developing, and for the immense skill and dedication of the physicians and nurses we depend on for our care and our very lives. I have seen that all up too close in the recent weeks, and I look forward very much to returning to the Senate soon and to rededicating myself to doing all I can to see that the very best in healthcare that I am so blessed to be receiving right now is made far more available to all our citizens and to all our peoples everywhere. The World Health Organization has brought you together today to recognize two unique and fundamentally important new global realities in this new century. The first is that people throughout our world urgently need and eminently deserve the full range of health services, including surgery for treatment of severe illnesses, traumatic injuries, disabling birth defects, and even safe childbirth. The second reality is the overwhelming need to assure patients of the safety of the care they receive. Such assurance is vital to preserving public trust in medicine, to making it efficient and affordable, and to preventing deadly harm. We know that simple, low-cost measures, such as checklists, can be immensely helpful in providing that assurance. It is a momentous breakthrough that so many of you from across the world have come together now to endorse that goal, and your assistance and commitment will be indispensable in making it a reality in practice. We all know that if a drug were even remotely as effective as checklists at proving as they are to be, advertisements for it would be everywhere on television, internet, and radio, and prescriptions for it would be flying off the shelves. But public health officials don't have the might of drug company marketing, and they need your assistance to make it happen. My hope is that in our country, Congress and the administration, we will see the immense benefit of this initiative and will work with all of you in the coming months to years to facilitate it. Certainly, when I return to the Senate, I intend to make it one of my highest priorities in health care reform. I look forward very much to working with you on it, and I commend you for giving it new focus and momentum through this conference. With great respect to you all my best wishes for a very successful conference. Thank you, Ted Kennedy.